Hi guys, thank you so much for joining me today. We are going to be starting a new series and we're going to be talking about some pathologies. So the first one that we're going to talk about is hypertension. So with hypertension, something that we want to keep in mind is that it's also known as high blood pressure. It's a sustained elevated blood pressure which is greater than 140 over 90 millimeters of mercury. This is often found undiagnosed and idiopathic, meaning they don't really know what's the main cause of it. About 1 in 4 adult Americans, have hypertension, usually found in men, African Americans, and those who are in lower socioeconomic status. So here's a picture that I found that breaks down what hypertension is and kind of what the ranges and the numbers are. So for normal blood pressure, we want to see 120 over 80. Pre-hypertension is 120 to 139 systolic over 80 to 89 diastolic. Stage 1 of hypertension is 140 to 159 systolic over 90 to 99 diastolic. Stage 2 is greater than 160 systolic, and diastolic is greater than 100. So it's important to keep those in mind, especially if you check your own blood pressure at home and you have that cuff. I highly recommend keeping these numbers kind of in the back of your head, not memorizing obviously, but just kind of knowing somewhat what the range is. So even though it is idiopathic, there are some contributing factors such as hereditary. It may be hereditary, meaning that if your family members are known to have hypertension, then you might have a higher chance of having high blood pressure. Also, those with diabetes, obesity, smoking. Smoking is usually the number one cause for almost every pathology, so by quitting smoking, I highly recommend not smoking. It will reduce your risk for multiple things. Lack of exercise, and then prolonged and recurrent stress. I do have some breathing techniques up on my channel as well if you want to check that out. Breathing can also help stimulate that vagus nerve and that parasympathetic nervous system, so it can help relax you and keep you calm, especially when you're feeling stressed. So I highly recommend going and checking those out. So next thing I'm going to talk about is that the signs and symptoms of a hypertension. So it's known as a silent killer. So even though it is a silent killer, even though we may not see like crazy symptoms, it's important to be aware of them, especially if it is hereditary or you are at a higher risk of hypertension. Just being aware of them. So common headaches, nosebleeds, fatigue, dizziness, and fainting. So just keeping those in the back of your mind as well. Next, some treatments, obviously, to make lifestyle changes, such as that quitting smoking, or even going out for a walk or biking, or whatever you feel like is going to entertain you the most and keep you moving, essentially. There are medications that are prescribed, such as beta blockers, diuretics, calcium channel blockers, ACE inhibitors, so making sure that you're checking those as well. So how is this going to affect PT? So obviously we want to continue to check those BP, the blood pressure and other vital signs. However, if they are taking beta blockers, that might not be the best way to kind of manage exercise during treatment, as they do blunt that heart rate and blood pressure, so it's not as accurate. So maybe doing an RPE and kind of measuring out based off the Borg scale, how much they are using, how much energy they are using. Also, just educating on any lifestyle modifications, just having them being aware of their choices and the risks that they might have. But there's a basic overview. Here is some references. But yeah, I do highly recommend quitting smoking, but that's just a brief overview of what hypertension is. I hope that you guys learned something a little bit, and on to the next one.